COVID-19 pandemic has overshadowed NCDs, though they still remain a big health challenge globally. People living with non-communicable diseases are most affected by the pandemic and face severe complications when infected, mostly due to their compromised immune system. In Uganda, few or no measures have been taken to protect people living with non-communicable diseases, specifically, or hear what they are going through, since there are hardly platforms for them to voice out their needs. Uganda Non-Communicable Disease Alliance, Uncda, therefore received funding from Non-Communicable Disease Alliance Global to implement NCD's Civil Society Solidarity Fund on NCDs and COVID-19 second phase project under Category 3 in 4 districts out of the 11 Uncda supported districts, that is Luka, Serere, Tororo, and Nakasongola. This project brings together people living with non-communicable diseases to voice out their views that will be fundamental in policy influence and decision-making in Uganda, most especially in this COVID-19 pandemic season. Uncda supported people living with non-communicable diseases at the health center facility level to form groups of people living with non-communicable diseases and carry out monthly meetings for people to strengthen each other, voice out their needs, and propose possible solutions to the problems they face during the pandemic. The persons living with non-communicable diseases, caregivers, opinion leaders, and well-wishers in health facility service communities have also been given a platform to dialogue about effects of the pandemic on persons living with non-communicable diseases and suggest possible solutions. There has been a series of people living with non-communicable disease group meetings carried out in the 4 project sites branches at each of the 4 health centers supported by the Uncda in each branch, and community dialogues in any of the selected health facility service communities. Following a series of these meetings and dialogues, Uncda attended 1 meeting and 1 dialogue in each of the project sites. This started with Luka District at Bukanga Health Center 3, with a meeting where about 20 people living with NCDs attended, including the in-charge Bukanga Health Center 3, Dr. Andrew Segonga. The dialogue was conducted in Bumanya Village Community Service Population in Bukanga Health Center 3, facilitated by people living with non-communicable diseases group leader Esther Cheuta. The branch leader, Hidaya Nangobi, sensitized participants about NCDs and how to avoid them. She further advised them to strengthen the formed groups to be able to share experiences on how to manage living with such diseases. Also, the eating habits were mentioned among the major causes of NCDs.
Ekitundu ekyasubwa kina kubaamu greens na fruit. Setegeza kulina kubako dodo ikubi ovacado mulibona ekitundu kyeswani ekisooka then kakwota akaswani kakwota mukategeera nakayina okubaako nti bando mutiere then kakwota akandi nakayina kuba budandaali woolya suwaani eyo otyo okumala omwaka mulamba ojja kuba okendeire niwo buli muzito ojja kuko ebintu ebindi kuba ebiri greens ebyo ebindi byovacado binazaamu mu mbiri ebikyafu.
Participants in attendance revealed NCDs they are living with, most common being high blood pressure, diabetes and cancer.
Era nga ndi mulwaire wa pressure wano wendwalira ntira okwida ku wano bankeberaku era omusawo ajja okunkeberaku duzi naida mu mwezi gweno ogwoguvuyireko naida ano okunkebera omusawo yankoba ati muna pressure yekoze eki eniinye.
Nize Kambeda Florence. Sukali anumye ekifuba omugongo buli ningo mubiri gwayokerera ekifuba muno.
Olwero bwasooka okunuma bwa asthma bumazeeko emyaka nga 13. Ekifuba kino nziwira kyanesiba nga tisobola kuweera era bandandabira wano bajja bankubeeko idagala mu misiwa muno me n'aba n'emirembe.
The participants mentioned the advantages of screening for NCDs, especially those who don't know their status, saying that when they screen, they know what they are suffering from and get medication, making life better and increase survival rate due to early diagnosis.
So, wabanga wekebeiza otegeera kyoidandaba kubanza olwadizuula nintandika ofuna eidagala egemagana do saawa eno mpeerako olubuto luliwona. So abakaali kwekebeza mbakubiriza nti mujje mwekebeze tusobole okwidandaba tube n'obulamu obulungi.
Participants still at Bukanga Health Center 3 suggested that UNCDA should extend its services to villages, especially screening services, because many people live with NCDs and they don't know.
Ndi ku suggesting anti bano bafanda nza bali tamusana akasente abatyamiza wano ndi basaba wani government nti ebikozesebwa mu idwaliro ndi basaba nti babiteewo in plenty kuba n'ekindi kyendi kwenda nti mobilization mu kyalo ebeemu ningina okusomesa ino abantu mu byalo n'okwongera otraininga abasawo baife abali ku facility.
However, in charge Bukanga Health Center 3, Andrew Segonga highlighted the challenges the facility has towards managing NCDs, with a major one being delay of NCD drugs from national medical stores, leading to shortages.
Facility here in Bukanga, we don't have the necessary equipment to run the tests. For example, for diabetes, we do not have the test kits. For high blood pressure, we do not have the BP machines. And for other heart diseases, it becomes very expensive and difficult to run the tests since we don't have even the machines to do some of those tests. Drugs, we've always run short of drugs, like for high blood pressure, drugs for diabetes.
The district branch leader also had a dialogue with persons living with non-communicable diseases in Bumanya village, Bukanga sub-county, Luka district, and also in attendance were people living with NCDs, well-wishers and community opinion leaders. People living with NCDs revealed how they discovered that they were having NCDs.
Nale bulungi ekyeyigulo n'alamba dyesa musanvu n'atandika okufuka wajja okukya kunchonga baafu ibiri n'awuna enkyo n'ajja mu idwaliro ojokebera nga sukaali ali 27 bakaba omusaadde oyo oli musawo tujja okwekebera bikoze mba tibayeeko na sayini yona yona.
Okusooka emyaka gibisewooko nalwala omutima nga ndi muvubuka wanuma emyaka gyayera 14 naawona bwenawona akawonero ekizibu kyasobola okufuna butanwa maadi paka olwalwo maze emyaka gyera kamaala uti 18 kino tuwulira nonto y'amaadi ngano just buno okukuba nti kiyagalire ayi ningensiga mukasana ningenkola emirimu tiwulira notera amaanyi egano ekisabe kyabita kabisa ndowooza emyaka giri 4 najja okwekebeza ati pressure akoze eki andemi najanga ndi mulamu bwale bukanga.
The major NCDs that were mentioned were diabetes and high blood pressure. However, men with diabetes exposed that they became impotent as a result of the disease.
Mani geisada gagulula
amasanze
gavuwa kuchwe na kwa ndika itabu che era banja kuzirikana nayo mwido na complain ko ba cancelinga nje mwe kuda kwira complain mpala cyo
n'abakazi basatu aye yakuba ntwazana nabo abana myaka jiweze kwa ingoli bakolala mani gampwa gasalira ko mu kisenge kati nzirangeri yona mama babawo engeri yokuza amani gange tambule niba nanga.
They also stated that COVID-19 pandemic affected them much, like making it difficult to access health facilities for medication because of lockdown that was in the country.
Yatukosa ino kuba ndi omu ku bantu ababitibwa n'amaze okufuna okukeberebwa nga ni sukali mwezi ogw'omusanvu na kwete omwezi nga 4
lockdown kyakusanze nga tifuna ki tifuna idagala aye Katonda yanamba nti pegana kudino bwenye kwekebezaako aba mu 13 kinana obisi 35 kinana atu
I got affected with diabetes. I was getting his treatment from Bukang Health Center 3. But when I always visited the health center, they were eliminating me because of COVID. When the health workers doesn't want to attend to me, when they are suspecting me to be a victim.
In the meeting, they came out with the ideas that can help them live with NCDs, like doing physical exercises and healthy eating.
Obulebe asukali nga ifo tuliga tukole mu mulimo to program ntibuna ka test mukenga mukuku banondega ndi kwisomero tuyire ekyo kyendi kubasaba era twaba tuvuire nga tutandikirewo.
The other meeting attended was at Serere Health Center 4 and the dialogue in Abiliep Village, Osuguro Parish, Olio Sub-County in Serere District, and in attendance were over 20 people living with NCDs for a meeting and over 30 participants for the community dialogue. The meetings and dialogues were facilitated by Enabu Richard, a group leader of persons living with non-communicable diseases at Serere Health Center 4.
That is for people living with non-communicable diseases.
However much NCD is trying, however, the community still needs more campaigns, more information about NCDs. Some of them are living without knowing they have the NCDs.
However, according to information from the participants, it was discovered that majority of people living with NCDs in districts haven't got COVID-19 vaccination, attributed to misleading information they get from different angles, including social media platforms.
So, for social media, when somebody who had already got the vaccine, and they were trying to put a bulb here, that it lights. When you put a magnet, anything, it remains here. So those are things that are scaring people from getting the vaccine.
Only rumors, but I don't know what that thing is. But only rumors for that. Some people can say that thing is not good, you can pay a lot. If you finish 3 years, you can die like that.
Sarah Asio, UNCDA branch leader, Serere District, and Richard Enabu, group leader of persons living with non-communicable diseases at Serere Health Center 4, while at Abiliap Village, sensitized participants about the importance of getting COVID-19 vaccination and urged those that haven't to embrace the exercise, because people living with NCDs are vulnerable when they contract COVID-19.
Most of that information is myths.
So, Ijai inoto jo Serere Center. Ijai bere bono jo kono. Nada inoto jo kati kadungu numina. Ache para tamine ngasama nene kadungu. Ota ukansa mina. Mami mabere tunyonyo ekato loijo le corona. Era go jabu ne rapapai. Do na ti ne munara akima papai. Era be sai darabe bala isere. Ijabo dono jo.
Let's count ourselves fortunate that we have the COVID injection vaccine being administered in Serere Health Center. Some of these health centers, those people are far and they rarely get that vaccine immediately. They also have to come back here to Serere. Well, we had a number of issues they came up with as to why they were laying fears not to go for vaccination. We have tried to talk to them. Let me hope that this sensitization we gave them will be able to open them up and go for vaccination.
In Tororo, the attended meeting was held at Nagongera Health Center 4, facilitated by Oyuchi Stephen, group leader of the persons living with non-communicable diseases at the health facility. The dialogue was at Iyolwa Sub-County, also facilitated by Okecho Benya, group leader of persons living with non-communicable diseases at Iyolwa Health Center 3. In the meeting at Nagongera Health Center 4, people living with NCDs were those with high blood pressure who say it developed as a result of COVID-19 effects like loss of jobs, poverty, domestic violence, and other COVID-19 related effects.
When I went for testing and I found that I have pressure, and this pressure I developed due to the first lockdown. Because I have children, and the only source I had, it was my job, and we were locked down. So due to that, I developed pressure.
The type of NCD I have is a high blood pressure. I came to know about this disease when I was seriously sick, and I was taken to the hospital. Now when I was introducing myself to the doctor, so he looked at the sign and symptom of my communication and says, we are going to test for high blood pressure, we are going to test for diabetes. High blood pressure reacted, and they introduced me to drugs for high blood pressure just of recent. During that time we were overthinking how to survive. There was no money, there was no way how to look for money. I was doing small business in the center. Now when there was lockdown, so the business also stopped, collapsed, and yet I had borrowed a loan. So I was thinking all the time of how to pay back the loan.
They also revealed that people living with NCDs found it difficult to access health facilities, yet they were on medication which left them unattended to.
As we are not to move, I found difficulty in moving because sometimes I go to the main hospital when the waist pain is too much. So getting transport money is a problem.
At the dialogue in Iyolwa Sub-County, where the in-charge of Iyolwa Health Center 3, Difas Jenga, attended, members raised concern for delay in getting health services when they visit the Iyolwa Health Center 3.
Our request is that at time they move up to the health center 3, most times, when they reach the health center 3, they find that the machine or the gadget they use there for measuring their pressure or whatever they are suffering is there.
Ani atonga paran maduong tatake. Idakuya kirino yaurwe Kenyo clinic.
She also needs to know that there is a particular department there.
Maro pino pinira, okay?
used to go there for testing.
Akidanyewa nyewe yen.
He used to just go and buy her own drugs.
Takwayo ne lwenyiruwa wini be wanwa yen ma waniti kliniki ma wano.
She's requesting that let there be department where they can also go and get the drugs from.
Jenga, the in-charge, clarified on why sometimes there is a delay, citing the issue of blood pressure testing machines lacking cells. He, however, applauded the Uncda for screening machines that they donated to the health facility, which has improved service delivery.
For us, we have made it mandatory that every adult above the age of 30 years, we check for blood pressure. So the machines that we received actually have helped a lot, because right now, since we introduced the mandatory checkups, we've realized that the number of clients that we are getting with NCDs has increased.
However, according to Jenga, a number of people testing for NCDs have increased at the facility, the most common NCDs being high blood pressure and diabetes.
These days, with this NCD program, we have seen the number every day increasing and increasing and increasing. And I'm wondering whether something has changed, but the truth is a big number of especially elderly people above the age of 50 years. Most of them, when they come and we check, we find their sugar level high, we find their blood pressure high. The good thing is that we are able to manage these conditions. We have the drugs, although most times these drugs run out of stock.
He says that they receive an average of 4 people every day testing for NCDs.
On average, we can get around 4, and the commonest is high blood pressure.
In Nakasongola district, 2 dialogues were attended, one at the district headquarters as a service community of Nakasongola Health Center 4, and the other was at Kakoge Health Center 3.
Groups tufune engeri gye kituyambamu ebintu bye twetaaga okubeera okati ng'omulwadde wa sukaali wetaaga okubanga okebera sukaali wo oluvannyuma lw'obudde.
Mu group eno buli kirwadde tulina be tukaddemu. Abalwadde b'ensimbu balimu nga 3, naye nga bagenda beera n'ekitabo bawandika abalwadde baabo bonna. Kati bano 3 be balina okujja balinga boogezangi abalwadde b'ensimbu naye n'ab'essukaali nabo balimu nga abantu 8 naye nga lisiti yaabwe mu kitundu bonna baliwa bali mu katabo.
Basically, when we look at NCDs, non-communicable diseases in the district, we have a very, very big challenge. A lot of focus has been put on HIV, on TB, and but very little has been put on combating non-communicable diseases. We have problems like, for example, I'll give you an example. In Abisura Health Center 4, we have about 5 to 6 patients who constantly come in wanting insulin, injectable insulin. We have, on average, every clinic day in Abisura Health Center 4, we would have about 10 to 20 patients suffering from high blood pressure, coming for drug refills. The medication that we get in our health center 4s will cover just a few patients.
The Nakasongola Health Center 4 Service Community Dialogue was also attended by District Health Officer Dr. Byamukama Agaba and health workers from Nakasongola Health Center 4, well-wishers and people living with NCDs.
Omuntu gwe twataddewo ne namba y'essimu weeri bw'omukira bukubizi nti tuuse naye nte siraba kigenda amaaso ajja kulabe agenda kukebera.
Kubanga amasavu gano buli lwe gakoma okubeera mu mubiri gagenda kwelembeka mu misuwa. Okitegeera? Ojje musawo pressure zirinye ate nga gwosiiba ku mucomo gwosiiba ku biki ku bisava okitegeera.
They clarified on the NCD Clinic Day to always be every Friday, third week of the month, though the district health officer was suggesting that it should be done on a weekly basis.
This observation is as a result of knowing that there are many people who have NCDs and who are not aware of their status. And the moment you put the clinic once a month, some of these people will be denied the opportunity to access the right health worker who can do the needful to see that they are served very well. And also people who have chronic illnesses need more time with the health worker. The moment the clinic is running once a month, you will have many patients standing up on a particular day and you will not have adequate time to be able to sit with them, counsel them, study their problem and treat them appropriately.
When it comes to access of services to these people in COVID-19, we had a very, very big challenge during the lockdown. Number one, transport was very difficult. These people actually move on borders. And when the movement became a little bit restricted for them, it was very hard for them to reach us. So we'd get some of them would call us and request that we go to their homes and diagnose them and treat them. But also this puts us, one, the healthcare workers have been very busy through this period. Number two, we lack the resources to say we are going to go to patients' homes and do treatment.
Dr. Byamukama Agaba also highlighted on the eating habits that people should be careful with to avoid getting NCDs and those living with them to avoid complications.
Olusi abamu ne pressure nezibakuba kwe kutegeera nti balwadde baaki. Ate ebintu bino twandibadde tusoma ne tubitegeera ne tusobola okwekuuma nga twekuuma tutya mu kulya kwaffe, mu kukola exercises. Ebyo ebibiri kasita obitegeera endwadde nyingi zino zetubadde soma osobola okwekuuma nga tozirina.